Hello. Today, I want to take a minute and answer some frequently asked questions. I went through and I looked back at all of my comments and questions that I get online and by patients. And I wanted to take a minute and answer some of the most commonly asked questions. Okay, so one of them is, how do I know if this is new onset anxiety or perimenopause? That is a wonderful question. So, a significant amount of women in perimenopause will describe new onset anxiety, ruminating thoughts, right? They will say to me, I've never had anxiety in my entire life. And all of a sudden, I'm worrying. I'm up at 3 a.m. and I'm worrying about things that I never worried about a day in my life, and silly things that, they don't even think have any purpose to anxiety. So, yes, perimenopause, as we're losing that estrogen, right? Remember, estrogen is and progesterone, right? Progesterone is the GABA of our brain. That is the thing that helps us calm our Netflix and chill. And estrogen brings serotonin in our brain, which is our natural antidepressant. So, yes, anxiety can be a symptom of perimenopause. Also, if you suffer from anxiety already going into perimenopause, it can make your already pre-existing anxiety worse. We do see this quite frequently. Okay. A question on the topic of weight loss and metabolism is, I'm eating less, working out more, but nothing's changing. This is one of the first things that we hear from women who are in perimenopause. They say, especially the top athletes, they're saying, I'm doing everything right. Normally, I would go into the 6 or 8 week cut. And this would happen. I have not changed a single thing, and then they're unable to make those gains. Again, it's estrogen, testosterone plays a big role in this too. But also, as we become estrogen deficient, we increase our cortisol levels. And what do we know cortisol does, right? Increases our visceral belly fat and messes with our metabolomics. So we see this very frequently. This question that I can't make any changes when I normally could, or I'm gaining weight despite doing the same thing. I haven't changed anything. I'm not eating McDonald's 50 times a day, but I'm still gaining weight, right? I'm still doing all the things. One of the other most common reasons, though, for women to be gaining weight or to not lose weight is that you're not intaking enough calories. So we think, the old dogma of calories in, calories out, which to some aspect is true. However, if we're not taking in enough calories, enough protein, the body goes in what we call starvation mode. And at that time, the body will hold on to everything and keep it and store it as fat. So sometimes by increasing our caloric intake, prioritizing protein, healthy fats, we're able actually to lose weight by eating more calories and eating less. So that's very, very, very important. I'm tired all the time, but my brain won't shut off. We hear this a lot. I'm exhausted, even if I get 8 hours of sleep, but my brain just keeps going. We call those ruminations, ruminating thoughts. And that a lot of times is due to low progesterone, actually. Why that can happen. Estrogen also plays a role, but that low progesterone. So a lot of times, if we put you on progesterone, we're able to kind of calm those things down. But we call it being tired but wired, right? Your body is tired, but your brain is not shutting off. We need to get some of that GABA back to the brain. So we do see that a lot in perimenopause. Another thing is my skin, my hair, and my body don't feel like myself anymore. This is very common, especially the skin. Now, remember this about skin, that we start to lose collagen pretty profusely in our 30s, right? And then it's worse in our 40s, and there we go. Then when we compound estrogen, progesterone, testosterone loss, remember estrogen is responsible for collagen and elastin, all these things play a role. So now we're compounding those things on top of collagen and elastin that we're already losing, right, at a pretty seductive rate. So now we have double whammy. So people will say, I think I was doing fine. All of a sudden I looked in the mirror and I aged 10 years. Yes, very, very common. So a lot of times when we give them back hormones, then we can do some other treatments, microneedling, PRF, things that are going to increase that collagen production back to those areas. We're able to reverse that course. And people will say it just happened all of a sudden. Like one day it wasn't, and the next day I looked like I was, 80. It's not quite that dramatic, but it definitely is. It definitely is there. And let's see. I've hear this a lot. I spent decades taking care of everyone else. Now what? Okay. So there is this point, and it's typically, again, this is not a statistic, but what I see in my practice, 40, around the age of 40, where women will say, enough is enough. I've done everything for everybody else my entire life. Now it's me, right? Now it's me. Or what else could be happening is that we are starting to not feel like ourselves. We are starting to have estrogen, progesterone deficiency, testosterone deficiency. And so that may wake us up, right? And say, hey, now it's time to take care of you. So if you're a woman that is hearing this and you're in your 20s and your 30s, don't wait until your 40s to start taking care of yourself. But we can reverse it, right? We can put things into play. We can make lifestyle changes. We can get that back. Another question is, I suffer from PMDD, and I've seen this a lot. Is there anything I can do besides antidepressants and birth control pills? Yes, 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 yes. Okay. Yes, 100 times over. 1 in 4 women in their lifetime will experience PMDD, premenstrual dysphoric disorder, and it is debilitating. If you don't have it, you're glad. If you have it, there is help and there is hope. Okay. So, and it doesn't have to be antidepressants or birth control pills. So yes, a lot of times giving women back their natural hormones, right? Which is what the problem is when we have PMDD. When we give back those natural hormones, then women do a lot better. And we're able to, that at least that second half of that cycle, when their symptoms are so severe, we're able to take care of them and get them at least, where things are a little bit tolerable, from that perspective. And then a very frequent question that we had was about regenerative aesthetics, and what's the difference between platelet-rich fibrin or PRF and filler? So the difference is this. PRF is taking platelet-rich fibrin. It's taking your own blood products. We spin it down, take all those healing products, and then we use that to fix the problem, right? So for example, if you have your mid-face volume is down, right? This is why we get sagging here. Then the problem is that these fat pads, right, have been depleted, or you're losing volume here, the collagen and elastin. So instead of using a filler, which isn't necessarily wrong, right? It's whatever you want, but a foreign substance to build that back up, we're taking your own product and your own healing factors to rejuvenate and regenerate the collagen and elastin to revitalize those fat pads. So we're fixing the problem at the root of it instead of just filling the problem, right? If we're talking about fillers. So it's definitely a more holistic approach. And it's definitely not instant gratification. Anything that's regenerative isn't instant gratification, right? Because it's got to regenerate and do over time, but you are actually fixing the problem. And then one question that I really like is, everyone in the zeitgeist says that everything is perimenopause. Is that true? So the answer to that is no, right? Certainly, if you have heart palpitations, it could be something cardiac, right? Certainly, if you have anxiety, it could be anxiety. Certainly, all of these things, right? However, if we're looking for unicorns, right, we should be looking for horses. I would say that perimenopause causes so many of these symptoms that what is the harm of treating like perimenopause, giving back some hormones and seeing if those things go away? If they don't, right, then we need some further investigation down that line for those things that were going on. And every woman is different, right? This is first off, I'm not your doctor, so this is not medical advice. It's just for educational purposes. But this is what we believe in: precision guided care, right? Precision guided care, which means we have to know you. It's all specific to you, your history, and what's going on with you. So someone that may be having palpitations and does not have any other history, it may be a smart or wise idea to try hormones first. Someone else, it may not be, right? Given your history, it may be smart to run down the cardiac factor worse. The point is, they're right. Everything perimenopause? No, it can be other things, but a lot of things are. Okay. And where we see the problem is when women get worked up for all of these things. They have a neurologist and a cardiologist and all these things. And they don't have a brain tumor and they don't have MS and they don't have heart disease. But nobody says this could be your hormones. Nobody tells them that. Okay. And that's where we see the problem. Okay. That's where we see the problem. So I hope this helped a little bit. These are just some of the few questions that we see over and over again. We'll come back again and do another segment. If you have a question or you have a symptom, please put it in the comments. Obviously, subscribe, and we'll see you again soon.